Healthcare costs in Karnataka just got costlier. The Siddaramaiah government has put a 20% hike in treatment and diagnostic test charges at hospitals under the Department of Medical Education. Now, the revised rates are now in effect at facilities like the Bengaluru Medical College and Research Institute and other autonomous medical institutions across the state. The BMCRI officials have confirmed the charges for treatment, surgeries, blood tests, and scans have all been adjusted. While the Karnataka government continues to cover these costs for BPL cardholders, non-BPL patients will also face the impact of this hike. Now, here's a quick look at the new rates. Charges for shared special ward have gone up from 750 to 1,000 rupees. Single bed special ward rates have jumped from 750 to 2,000 rupees. And general ward fees have risen from 15 to 25 rupees. Listen into some of the reactions.
ಪರಿಷ್ಕರಣೆ ಅಂತ ಹೇಳಿದ್ರೆ ಕೆಲವು ಯೂಸರ್ ಫೀಸ್ ಏನಿರ್ತದೆ ಅದು ಭಾಳ ವರ್ಷಗಳ ಹಿಂದೆ ತೀರ್ಮಾನ ಆಗಿರುವಂಥದ್ದು. ಅದನ್ನೇನಾದರೂ ನಾವು ಒಂದು ಕೆಲವು ಕಡೆ 10%, 20% ಈ ಥರ ಸ್ವಲ್ಪ, ಯಾಕಂದರೆ ಎಲ್ಲ ಆಗಿದ್ದು ಈಗ 10 ರೂಪಾಯಿ ಇರೋದನ್ನು 20 ರೂಪಾಯಿ ಮಾಡೋದು, 20 ರೂಪಾಯಿ ಇರೋದನ್ನು 50 ರೂಪಾಯಿ, 40 ರೂಪಾಯಿ. ಅದರಿಂದ ಆವಾಗಿನ ರೇಟ್ಗಳೇನಿತ್ತು ಇವಾಗಿನ ಒಂದು ರೇಟ್ಗೆ ಒಂದು ಹೋಲಿಕೆ ಮಾಡೋಕ್ಕಾಗೋದೇ ಇಲ್ಲ. ಆದರೆ ಜನರಿಗೂ ಭಾರ ಅಂತ ಏನಲ್ಲ, ಆದರೆ ಒಂದು ಕನಿಷ್ಠ ಏನು ಆ ಯೂಸರ್ ಚಾರ್ಜಸ್ ಏನಿರ್ತದೆ ಅದು ಒಂದು ಮಿನಿಮಮ್ ಒಂದು ಜಾಸ್ತಿ ಅದು ಹೊರೆ ಆಗದೇ ಇರೋಂಥ ರೀತಿಯಲ್ಲೇ ಇರುವಂಥದ್ದು. ಅದರಿಂದ ನನಗೆ ಅನಿಸುತ್ತೆ ಇದೇನು ದೊಡ್ಡ ಏನು ವಿಷಯ ಏನಲ್ಲ. ನಾನು ನೋಡಿದೆ ಕೆಲವು ಕಡೆ ಇದೆಲ್ಲ ಇದು ಮತ್ತು ಇನ್ನೊಂದೇನಾಗಿದೆ, ಸರ್ಕಾರ ಏನೇ ಮಾಡಿದ್ರು ಇವತ್ತು ಗ್ಯಾರಂಟಿ ಸ್ಕೀಮಿಂದ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಇದು ನನಗೇನು ಅರ್ಥನೇ ಆಗೋದಿಲ್ಲ. ನಾವೇನು ಏನೇ ಮಾಡಿದ್ರು ಇವತ್ತು ಗ್ಯಾರಂಟಿ ಸ್ಕೀಮ್ ದುಡ್ಡಿಲ್ಲ ಅದಕ್ಕೆ ಮಾಡ್ತದೆ. ಪರಿಷ್ಕರಣೆ ಹಿಂದೆ ಎಲ್ಲ ನೀವು ವಾಟರ್ ಬಿಲ್ಗಳೆಲ್ಲ ಹೆಚ್ಚು ಮಾಡಿಲ್ವ, ವಾಟರ್ ರೇಟ್ ಹೆಚ್ಚು ಮಾಡಿಲ್ವ, ಕರೆಂಟ್ ರೇಟ್ ಹೆಚ್ಚು ಮಾಡಿಲ್ವ, ಈ ಮತ್ತು ಬೇರೆದೆಲ್ಲ ಹಿಂದಿನ ಸರ್ಕಾರಗಳಲ್ಲಿ ಮಾಡ್ಕೊಂಡು ಬಂದಿದ್ದಾರೆ. ಅದಕ್ಕೆ ಇದನ್ನು ಈ ಹೋಲಿಕೆ ಇದು ಅನಾವಶ್ಯಕ. ಇದು ಭಾಳ ವರ್ಷಗಳ ಹಿಂದೆ ಇದ್ದಂಥ ಒಂದು ಏನು ರೇಟ್ ಇತ್ತು ಅದನ್ನು ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಹೆಚ್ಚು ಮಾಡಿದ್ದಾರೆ ಅಷ್ಟೇ.
ಅಂಡ್ ಯಾರು ಅದನ್ನ ಹೇಳಿದ್ರು ಕನ್ನಡ ಬರಲ್ಲ ಅಂತ ಹೇಳಿ ರೆಕಾರ್ಡ್ ಮಾಡಿ ಟೇಕ್ ಆಕ್ಷನ್ ಅಗೇನ್ಸ್ಟ್ ದೆಮ್. ದಿಸ್ ಇಸ್ ವೆರಿ ಸ್ಟುಪಿಡ್. ನಾಚಿಕೆ ಆಗಬೇಕು ಅವನಿಗೆ. ಅದನ್ನ ಹೇಳಿ ಯಾರು ಅವರು ಟೀಚರ್ ಯಾರಿದ್ದಾರೆ BO, ನೋ ದಿಸ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಟೇಕನ್ ಅಪ್ ವೆರಿ ಸೀರಿಯಸ್ಲಿ. ವಿದ್ಯಾಮಂತ್ರಿ ಕನ್ನಡ ಬರಲ್ಲ ಅಂತ ಹೇಳಿ ಯಾರೋ ಹೇಳ್ದ. ಯಾ ಕರೆಕ್ಟಾ? ನೋ ನೋ ಯಾ They said that? No, you have to take action. ನಾನು ಅದನ್ನ ಸುಮ್ಮನೆ ಕೂತ್ಕೊಳ್ಳೋದಕ್ಕಾಗೋದಿಲ್ಲ.
Now I'm being joined by my guests, representatives from both the BJP and the Congress as well. G.S. Prasant, spokesperson of the Karnataka BJP, joins me, and Deepak Thimaya, spokesperson of the Karnataka Congress, is also with me. Thank you both, gentlemen, for joining me. My apologies for making you wait, and if I could beg your indulgence for 2 more minutes, I also need to get in my colleague Neha on the broadcast as well to get in the latest update as well. Neha, coming to you, this is quite a controversial move in terms of the response it is emitted from the opposition as well, because it's not just quite sizable increase in the medical hospital fees that have been announced, but also a deduction in the total number of BPL cards in circulation. What has been the justification of the Karnataka government to take in such radical steps?
Well, Ritanshu, if we're talking about the hike right now that's set to be seen in government hospitals in the state of Karnataka, the government, in fact, of course, on its part now is clarifying that, this hike is something that would not really affect BPL card holders or the below poverty line card holders per se, but the fact that, this is a user fee now that was pending for a long time, and which is why it's now being brought in. Of course, as far as, this entire issue is concerned, we're also now picking up that, the hike is in fact quite steep in a couple of cases. Now, for example, if we are to talk about the special wards here, the charges of the beds there that were earlier 750 have now gone up to nearly 2,000, which is of course, more than double even. In fact, that's even, of course, something now that's really gone on to possibly pinch the people. Of course, how this is going to be received now by the people in government hospitals, especially those who engage services there, is something that remains to be seen. But the fact is that, the politics around this entire issue isn't dying down anytime soon. We're seeing the manner in which the opposition, of course, has mounted its attack here on the government, raised questions about how basic things like, medical facilities and healthcare isn't something that, the people should have to pay so much for. But we'll really have to wait and see how this pans out now in the coming days, and whether this is, of course, going to have any sort of an impact as far as the footfall at government hospitals are concerned.
Neha, thanks a lot for joining us with those details. Let me now go across Deepak Thimaya, spokesperson of the Congress. Deepak, a lot of, political sense dictates that one generally does not do any step which impacts the poorer people, but that's exactly what this move is going to do, because you've made hospital wards quite steep in some cases, the price of attaining these medical facilities here. What is the defense which the Karnataka Congress is doing? Because the opposition says that this is just a desperate attempt to garner more funds because the Karnataka government is effectively broke.
See, first of all, your correspondent herself told that this doesn't affect the BPL card holders. And this is also for people who do not have any other schemes to cover them. And also, let me tell you, if at all there is any particular patient who cannot pay this money at all, that person's fee can be waived by the discretion of the director of the hospital. You have to understand the whole gamut of these things, and then you should, perhaps get into the idea of how the government is trying to garner 10 rupees, 20 rupees from everywhere and put it together to take care of the deficit in terms of the shortfall because of the guarantee schemes. I think there is a concerted effort to villainize the Congress government in Karnataka. Nobody tries to understand that whatever that's been done for the people of Karnataka has been done for the people of Karnataka. It was not done for Mr. Siddaramaiah or Mr. Rahul Gandhi or for Mr. D.K. Shivkumar. This was done for the people of Karnataka. If people have such a grouse against the people of Karnataka from getting anything, they are talking about doing things for the people. But when you do things for the people, you say, why are you doing things for people? Particularly, you say that you don't give free things for people, and when you actually charge them a little more money because you're trying to give better facilities, you're showing things. You're showing the pictures of such beautiful hospitals, such beautiful facilities. You would be surprised to know that in a hospital, like in a place like Madikeri, the headquarters of a district, they've recently installed an MRI machine, a state-of-the-art machine. And that was even not something that people imagined before. That's because of the effort of an MLA. And when people can pay, when compared to like 10,000, 20,000 rupees in a private hospital, and this is the kind of money that the hospital is only taking to keep in itself. It is not going to give it to the government. You should be able to understand all these things, perhaps even before you get into these debates. I'm sure there are a lot of intelligent people in BJP who can understand these things. They should not get into petty politics of some of those, jobless politicians in that party. I'm sure they should be able to stand together because we're doing it for the people, and these programs are going to continue. It's such a sad thing. Just because you're given guarantees, you nowhere gave a guarantee that no price will be hiked, no seventh pay commission will be implemented because there's no money. Whenever it is beneficial for the BJP, everything is fine. Whenever it is like an inconvenient, I think that's when they start questioning. I'm really sad about it. We should all be in it together to do the best for the people. If this money is going to be used for the hospitals, used for the betterment of the hospitals, people are ready to do it. Nobody complains. If people are saying that I'm ready to pay the bus ticket money because I can pay that money, so don't give me free, there are people like that. BPL is exempted. People who come under the schemes are exempted. So please let us understand the whole gamut of things and then discuss these things, please.
Fair enough. Deepak Thimaya, you made a very important point as well at this point, that nothing should ideally come free, and at some point the cost of realities of a society where inflation is a constant inevitability need to be impacted. And if you're giving better facilities, let me then bring in GS Prashant, spokesperson of the BJP at this point. Prashant, the point being made by Mr. Thimaya is that, is it fair to criticize the Congress government if it gets something for free, if it also decides to charge value for an improved value of or quality of services providing, even then it has been criticized?
Ritanshi, correct. We should not be criticizing Congress for pothole-ridden roads, for crumbling infrastructure, increase of petrol and diesel prices. We should not be complaining about Congress because, after all, we should be happy that Congress is increasing prices. Is that what Congress is trying to say? And now, every increase in price, if they justify saying people are not against them, people will show them their place. People believe that Congress will do something and give them a mandate of 136 seats. But for people, when it comes to people, it is increase in prices from 750 rupees to increase to 2,000 and say, look, people are not complaining. But what are the people getting in return? Increase in price hikes, poor infrastructure, zero governance. At the same time, what are the politicians getting? 700 crores through wine merchants' bribes. The chief minister gets 14 sites in Muda. The another minister gets money from Valmiki Maharshi scam. and Kharge family grabs land of 5 acres for skill development and subsequently returns it. This is what Congress ministers and leaders get. And what do the people get? People get increase in petrol prices, increase in diesel prices, increase in milk prices, no infrastructure, pothole-ridden roads. So therefore, Congress is very clear what they want to do. And the best of it, Congress can go to any extent for appeasement politics. They're able to now snatch lands belonging to poor farmers and Dalits and make them as work property, so that one particular vote bank or one community which backs Congress and which Congress thinks is vote bank is taken care of. And the coffers are running dry because there is no money. They have increased all possible taxes. Stamp duty has been increased. Registration charges were increased for different classes of people.
Okay.
So therefore, without any proper planning, once they've increased prices and then they have doled out these guarantee schemes, the coffers are running dry. And on one hand, the Congress leaders indulge in corruption and loot the public. And now, whatever little services you ought to give to public, now you are making them pay enough and more for that. This is the hypocrisy of Congress, and Congress stands exposed for this.
Deepak Thimaya, would you
What
like
can
to
you
reply
expect
to
from
Mr.
Congress?
Prashant's response
Yes,
to
this is
charges?
not about the petrol charges, which is basically affected by the BJP government. And I think that today, if at all you know that why prices have increased and 28% GST and things like that, Mr. Prashant, who is of course an intelligent
Mr.
person,
Thimaya,
would be able to
petrol and
give more
diesel outside
explanation
the
on
ambit
that.
of GST. Be very clear.
Yeah.
Prashantji,
Petroleum
let
products-
let
No, no,
Mr.
I'm not
Thimaya
talking
speak.
about-
We don't have a
I'm not
lot of
talking
time on
about-
this debate, so
Yeah,
I
this is
want it
not
to be a
about
structured
saying,
one. Mr. Prashant, I will come to you after this. Let Mr. Thimaya respond to your charges.
I was just not talking just about the petrol. Let me tell you very clearly, if at all you're if at all you're asking a question about why a special ward room's price has been increased from 750 to 2,000 rupees. A special ward is normally not taken by a poor person. I'm sure a person who is asking for a special ward is asking for it at a special price. I'm not completely defending any kind of burden on poor people. But if people who can afford it, if they can pay for it in a private hospital and stop, because I've spoken to a private hospital person when the government was taxing them, when the electricity
Mr.
bill was very
Thimaya,
high.
I'm sorry,
this
this is where my point is. This is where I think all parties get it wrong. Even if a family is not a BPL family, even if a person can afford to pay for a special price, that the special ward, that money also comes from that person's hard-earned money. It's not that that person is some lakpati, that for that person 750 rupees to 2,000 doesn't make a difference here. So I mean, at the end of the day, you're asking for a more than 150% hike, if my maths is correct, saying that okay, this person is not poor, can easily pay for it. Those are not things that if a person is from middle class, that means that person doesn't deserves to be fleeced or what?
Yeah. Because 2,000 rupees is something, when he pays, he can certainly demand a certain level of comfort and also a certain kind of facility. When we are talking about very poor people, and I also told you, they should be not BPL or APL or come under any of the schemes of the government where things are exempted. It is only for those people who don't come under any scheme. And even then, if somebody can't pay the money, they can go to the director and ask for exemption. This was done after 5 years.
So the people who already don't come under any
big
scheme are the ones who are
organization.
further being milked dry in order to ensure that people who come under other schemes. It's the same thing we're seeing with the same argument that is leveled against the finance minister every year, that you continuously tax the middle class in order to ensure that your other welfare schemes are being funded. Nevertheless, Prashant, I'll let you have the last word and then I need to move on. Go ahead, please.
See, the Congress spokesperson was harping upon BPL cardholders need not pay. What is the Congress doing from the last 1 week, last a month? They have ensured that BPL card holders are being systematically told your cards are no longer valid.
It was started by the central government.
Which means, on one hand, they say BPL card holders are not impacted because you have removed out of them from that particular ambit itself. And
That's
this is
a
also not
directive
been done
from the central government, please.
They have not been given any notice saying you don't qualify to be BPL. So they have been getting the benefits of the BPL card holders without any verification. Randomly, Congress has ensured that people's BPL cards have been taken away.
Please join
and on the other
hands
hand, you
with us.
increase
We will
the
remove the
prices here.
fake BPL
It is not
cards.
about affordability. If it's affordability, the sitting Congress DCM who has thousands of crores can sponsor all of their health then. Because if it's about affordability, because he has anyway
Okay,
got
I need to move on in this debate here. I would love to have
It is
continued
not
further
about
because I think
affordability
some
there.
very valid points are being made. Nevertheless, I would just like to insist that just because a person can afford to pay for it doesn't mean that person deserves to be fleeced. I'm sure every citizen in the country is ready to pay
you can
more
say
if that
about
person
that
gets a
even for
bit
the
more
LPG
value.
to
India is a
everything, Mr.
value-conscious
Ratanshu.
society. It's
Mr.
not a
Bhattacharya.
price-conscious society, it's a value-conscious
No, but you have
society.
to say the
But
same
just
thing to
because a
Mr.
person
Modi,
can
no?
afford to pay doesn't mean that person is made to pay for other sections of society as well. I'll leave it at that, gentlemen. Thank you so much for joining us. We will discuss this in prime time ahead as well today.